ബയോളജിക്കൽ സൈക്കാട്രിക്ക് പ്രാമുഖ്യം നൽകുന്ന വിധത്തിലുള്ള സാമ്പത്തികശാസ്ത്രം ലോകത്ത് മുഴുവൻ ഒഴുകുമ്പോൾ ബയോളജിക്കൽ സൈക്കാട്രിക്ക് അപ്പുറം ജീനിനും ജനറ്റിക്സിനും മസ്തിഷ്കത്തിലെ രസതന്ത്രത്തിനും അപ്പുറം മാനസികാരോഗ്യത്തിൽ മറ്റെന്തെങ്കിലും ഘടകങ്ങൾക്ക് പ്രാധാന്യമുണ്ടോ? സാമൂഹ്യ സ്ഥിതിക്കും സംസ്കാരത്തിന് വളരെ പ്രാധാന്യം ഉണ്ട് എന്നുള്ള ഒരുപാട് പഠനങ്ങൾ മുന്നിൽ വരുമ്പോഴും അത്തരം കാര്യങ്ങളെ മറന്നുപോകുന്ന ഒരു സ്വഭാവ സ്ഥിതിവിശേഷം നമ്മുടെ സാമ്പത്തികശാസ്ത്രം നമ്മെ തള്ളിവിടുന്നു. അങ്ങനെ തള്ളിവിടുന്ന നമ്മളെ ഉറക്കുവാൻ ശ്രമിപ്പിക്കുന്ന ഇത്തരം ശ്രമങ്ങൾക്കപ്പുറം ഈ മേഖലയിൽ തനതായ ഗവേഷണം നടത്തുന്ന ഒരു പ്രതിഭയാണ് ഡോക്ടർ മാർഫി ഗാലിബർട്ടൺ. അമേരിക്കയിലെ സിറ്റി യൂണിവേഴ്സിറ്റി ഓഫ് ന്യൂയോർക്കിലെ അസോസിയേറ്റ് പ്രൊഫസർ ഓഫ് കൾച്ചറൽ ആന്ത്രോപോളജിയിൽ വർക്ക് ചെയ്യുന്ന ഡോക്ടർ മാർഫി ഗാലിബർട്ടൺ കേരളത്തിൽ വിവിധ പ്രാവശ്യങ്ങളായി 9 തവണ വന്ന് വിവിധ പഠനങ്ങൾ നടത്തിയുണ്ടായി. ഡോക്ടർ മാർഫി ഗാലിബർട്ടനുമായി നടക്കുന്ന ഈ അന്വേഷണം മൈൻഡ് വാച്ച് സംസ്കാരവും മാനസികാരോഗ്യവും തമ്മിലുള്ള ബന്ധം എന്തല്ല എന്ന വിവിധ മേഖലകളിലേക്ക് നമ്മൾ കണ്ണോടിച്ചു പോകുന്നു. മൈൻഡ് വാച്ചിലേക്ക് എല്ലാ പ്രേക്ഷകരുടെയും ശ്രദ്ധ ക്ഷണിച്ചുകൊണ്ട് മൈൻഡ് വാച്ച് അന്വേഷണം ആരംഭിക്കുന്നു. In India or in developing countries, especially India, you have got a better social support system.
Exactly.
But in US, you don't have it.
Exactly. You see better social support. I mean, overall in the outcomes studies the WHO has done with lots of psychiatric instruments for many years, they show the global assessment of functioning, which psychiatrists use to assess functioning, to be very high in India and very low in the US.
Okay.
And at the same time, 90% or so, people in India, after an episode of schizophrenia or hospitalization, end up living with their families, whereas in the US, it's about 10% of people end up with the family. Mm-hmm. And so I think that may be a major factor. In my own, many people have looked at the family by like doing surveys and superficially examining these issues about why India does well. I'm going to try to get some interviews with actual patients and schizophrenic patients to see how they tell their own story. What are the factors that are leading to improvement? And I think it's very important as India considers future mental health policy to not get rid of whatever's being done well in this country, not to simply imitate whatever we're doing in the US. And I think I also mentioned the US actually is not doing very well. And one of the main reasons is, well, again, this person I mentioned earlier, Tanya Lerman at Stanford University and others have researched mental health care in the U.S. And basically, the system in the U.S. now is kind of a cycle where schizophrenic people will basically move from the emergency room because there really isn't a good public health care facilities for mental problems anymore, to the streets, to the police. They'll be picked up by the police, they'll go to jail, they'll maybe end up in transitional housing, they'll be homeless on the streets again, they'll do something strange
so mean to
or
say
illegal.
That the schizophrenics are not being taken up by healthcare system, it's by what is called your police system?
There are many schizophrenics in jail, and some researchers have argued that our primary healthcare system for schizophrenics in the U.S. right now is prison.
Okay.
There's actually an excellent...
But let me ask you one more question. Do you have community mental health programs in U.S.?
Well, that's exactly the problem. We have very poor and very few community mental health programs. A lot of this goes back to the deinstitutionalization of psychiatric treatment in the U.S. back in the 70s.
Yes.
The large state institutions were closed down. Motivated by the very good idea that we should provide treatment in the community. I think it's a very good idea, but the problem is when these institutions were closed down, the funding was supposed to follow the patient into the community, and there was expected to be a robust community mental health program.
That's right.
But that funding was cut. Actually, President Ronald Reagan at the time, it was one of the things that he cut he was trying to pay for tax cuts, and so that and nothing was ever put in its place. There was
so Reagan's magic worked on poor mental patients as well.
Exactly. Well, he cut a lot of social programs as part of his ideology of getting government out of the picture. And
so he was a Republican?
Yeah, Republican. Yeah. So there's ever since then there has not been any large public oversight of mental health care in the community. It's just a patchwork of bits and pieces. There are some very good NGOs that work in the community that try to
but
fix
the NGOs have got there are limitations. They cannot always think of a consistent flow of fund for various kind of programs, unlike government programs. Where you can guarantee that this much of budget money is what is called marked for this kind of a program. But NGOs probably they'll have to raise their fund and
That's the difference, exactly. They're small and limited in what they can do. It's like a patchwork. It's not a comprehensive system. And I think, actually there's a good book that came out last year that I used in a class I taught recently by Paul Broadwin called Everyday Ethics, when he examines one of these community mental health programs and how they struggle to work with
Where
mental patients. In the U.S., in a city in the Midwest in the U.S. And after I taught this book, and we also watched a film on the mentally ill in prisons in the U.S., my students were all up in arms, like, this is terrible, we must change this, and there should be more money spent. And I said, that's exactly the problem. Currently in the U.S., Obama and the Republicans are both cutting the budget for everything because they need to reduce the deficit, and the politics are that way. There's no scope for increasing, the help for mental health. And from what studies I've done in India in the past over the years of mental health, there are, I would say, better facilities, not in terms of the infrastructure and how nice the buildings are. We have beautiful buildings in the U.S., but at least in India, if you're schizophrenic, you can actually get more hospital treatment. You'll spend at least several weeks.
That's what.
Being attended to by therapists. In the U.S., it tends to be the police will often bring in a schizophrenic person who's just doing something strange, maybe illegal, but they'll take him to the emergency room, which will only hold him for 3 to 5 days because there's no funding. This person doesn't have insurance.
Thereafter.
Yeah.
Whether they are treated or not, irrespective of that, they'll be pushed out.
Well, they'll be treated, but what the psychiatrists do in treatment is they just they don't have enough time to accurately assess the person because they're there for a short time. So they just put
them on some drugs.
Right. They err on the side of caution. They put them on extra drugs just in case.
If you look at the family, like we have been having a so-called traditional concept of family. We had an extended family, joint family sort of in the stories. But now if you look at the Indian family system, of course I would say it's more like e-family. We are also probably the same way. Like we have got fragmented e-families. Like people may get connected in the evenings through WhatsApps or Facebooks. That's all.
Right.
But people are scattered at different parts of the globe, in fact, of the same family.
Right.
So the kind of family what we had is no more. I would say in Indian families at a crossroad in that sense. So would you say that probably we are also going to have the same kind of a picture what the US is experiencing at the present moment regarding the schizophrenics and other mental health issues?
No, that's a very good question. And that's something I hope to also keep I want to keep in my sights when I'm doing my research here in Kerala. Yeah, I think that while the family may be an advantage, that may be changing here. Yeah, India may be losing that advantage. So
I would say from extended family to e-family.
From extended family to e-family, yeah, exactly. I mean, this question to still be, are ill people taken care of by the family here, even if there is an e-family? And I think there's probably to some degree class difference. I know families in Kerala who I've known for a long time, and some of them are split up in the Gulf and in the U.S. and Australia. But also that's middle class families. I don't know about
but at the same day,
working class.
One more thing you'll have to watch and observe is that there is always a kind of movement from lower class to middle class also. That process is also already on. If you make a comparison between the number of people who were in the lower class and number of people in the middle class in the past, maybe some 10 years back, and if you make say similar kind of comparison with the present situation, I'm sure that there is an increase of middle class more comparing with the lower class.
Okay. You think it's growing? I don't.
That's a quite, for example, in terms of the purchase. The purchasing capacity of the people, purchasing power, the living standards, so-called, quote unquote. And if you look at on basis of these variables, definitely you will see that more people are changing from lower class into middle class.
Are they changing their lifestyles though? Are they breaking up from the extended family?
As a part of that, definitely they do change their lifestyles.
Right. No, I think these are important issues to watch to see how these changes. I think they'll take some time to unfold because I know I've spoken to economists, anthropologists, and sociologists who have also argued that India's tremendous economic growth has mostly benefited the middle class and the people on the top, and that there's a large mass whose lives are unchanged. Yeah. And that's not good, but also
the polarization definitely seems to be increasing between the haves and have-nots.
That may be happening. Actually, I spoke to a professor at the University of Hyderabad who was saying, who claims that increasing polarization is going on. I myself don't know the
picture.
Yeah, I haven't studied that issue specifically, but I imagine that as time goes on, we'll see what economic changes might and what economic changes lead to what changes in the family.
That's right.
And so, at the same time, there's these institutions that are very interesting in Chennai,
Right.
Banyan and Scarf.
Yeah,
that
Banyan
are-
and
that are
Scarf, of course.
intervening-
Banyan actually it is a community-based rehabilitation program by an NGO
Exactly.
where you get lots of schizophrenics, and being community-based rehabilitation program is given to them.
Exactly, right. And Scarf also, their support for schizophrenics to help them recover.
Recently, in fact, Banyan volunteers were very much strongly revolting against the current mental health care bill, which is to be made into an act very soon, and which is present in the Raj Sabha.
And actually, the work at Banyan and Scarf shows how social cultural factors are so strong. I mean, these people are not just given medications like many are, but they're given job rehabilitation and other social supports, which have been very helpful to them. So I think these
supported employment, and they do give lots of psychosocial interventions.
And at the same time, some of the research that I've read by the people working at these institutions do claim that groups like them have to do more work supporting these people because the family is not there as much as it was in the past to do some of the support. So that they may also have evidence of the changes of family and leading to the problems of mental health falling into the hands of the public or NGOs or things like this. This also reminds me that one of the researchers, Dr. Tara at Scarf, one of her studies with her colleagues showed a very high rate of marriage among schizophrenics, which is astonishing compared to the West. That most schizophrenics, I believe the rate was above 70%.
Marriage.
Studied in Chennai, eventually get married.
Okay.
Whereas in the U.S., it's a small minority of people who are schizophrenics.
Even about that 70% marriage, has there been a split, like between males and females?
There is a male-female difference. Off the top of my head, I forget what it is. I think it was easier for men to marry, but I believe that even for women, they were still doing better than in the West in terms of remarriage. So that's another way in which India, did surprisingly, and I would say still inexplicably well. I mean, why is it that it's so easy to get married after being schizophrenic when in the U.S. you're just believed to be just committed, you're going to be living in the streets and in institutions, and you're going to be alone. It's a very different cultural situation for schizophrenics in the two countries.
Now, another important thing what comes to my mind is adolescent and child psychiatry and culture. For example, now there is a lots of increase in the prevalence rate of so-called ADHD children.
Oh yeah,
Attention deficit hyperactivity children, and mostly it has been attributed due to certain biochemical factors in the brain, etc. But I think the Bowman, who was a veteran neurologist in the National Institute of Mental Health, US, strongly said that actually, this is a pseudonym ADHD, and he was attributing this, ADHD, so-called ADHD symptom, attention deficit hyperactivity symptom, mostly to parenting styles, punishment, and so much of stress, etc.
Or lack of punishment.
Exactly. Now, how do you look at this particular aspect? ADHD, is it something to do with especially so much of preponderance or the increase of ADHD is mostly something to do with the socio-cultural factors or biology? How do you look at it?
Yeah, I think I believe that ADHD is being overdiagnosed. Okay. And there may be some validity to the diagnosis as a biological basis or some other or through some other form, but I think it's being overused, and I'm not alone. Many people are critical that believe that what we're doing is, in my field, we say it medicalizing. We're medicalizing behavior.
That's right.
We're taking behaviors and putting them into medical categories and treating them and in that way they actually do become real illnesses because we've designated them categories for treatment, and we're intervening in this way. And there are many critics in the U.S. that believe this is problematic. At the same time, there are parents of ADHD children who are very much offended by the suggestion that it is somehow due to their parenting styles, and they claim that that it's not related to that. And so. So all said, I think that probably are legitimate cases. I've worked with people who's worked on this. I worked with a PhD student in psychology at my university. I was the anthropologist working with her, who was studying culture in ADHD. Students from different backgrounds. New York City is very diverse, people from all over the world, and she had students from different parts of the world, whose parents had settled in the U.S., and she did an ADHD study and found a lot of cultural variation. On that.
So you don't think that it's something to do with parenting style?
I would imagine parenting style is a factor.
Okay.
At the same time, the parents themselves with problematic children claim that it's not that. So I shouldn't speak because I don't have that problem in our family, and I can't claim to really know. But I think it's also definitely in the environment. Certainly the stimulation. In the U.S., probably here to some degree among some children, there's constant stimulation through electronic games and events, birthday parties. There's like a sense that a child should never have any downtime, any slow time. Mm-hmm. Your attention is constantly being called to attend to TV monitors, at restaurants. A typical American pub restaurant that has hamburgers and pizza that your family will go to will have 8 TV screens around the room showing different sports matches at the same time. And your cell phone is ringing. I think these are factors that actually increase the incidence of ADHD, but I haven't done a study on this. I can't show that this is so.
Suppose you did a PhD on a sort of a comparison of various, persons seeking mental health care from different systems. Like, for example, those people who sought mental health care from so-called psychiatry, allopathic psychiatry, and those people who sought mental health care from Ayurveda psychiatry, and those who have been going to religious places. And I suppose you have made a comparison of satisfaction among the clients who have just been moving to these different centers of treatment, so-called treatment. What was the finding, and how do you look at the finding, and what is your view on it?
Yeah, well, that study I did in the 1990s.
That's your PhD thesis, I suppose, right?
That was a PhD thesis, and then later on it became a book.
Okay.
I published a book on that study, and I guess I would to sort of summarize it into 2 findings. One of them is that among the 3 therapies I looked at, allopathic psychiatry, Ayurvedic psychiatric interventions, and religious healing, no therapy was simply better than the others.
Okay.
Instead, what I found is that some therapies worked for some people, and some worked for others.
Okay.
So
in that sense, would you say that at least maybe it may differ from person to person, but overall, if you make a comparison, would you say that religious therapies are also as effective or as ineffective as allopathic psychiatry?
Well, I tried to study to what degree patients improved or declined over at least a 6-month period. So it's not a very long period, but it's some evidence. At least 6 months, 6 to 9 months.
That's a good time, in fact.
It's okay. Yeah. And I found that the people in religious therapies did slightly better.
Better than?
But it was not a statistically significant finding. There wasn't enough,
in
patients. Exactly.
But in terms of analysis.
In terms of the numbers. So my conclusion was actually that all 3 did roughly equally well.
Okay.
But it certainly is worthy of more studies, because there have been people from NIMHANS who've studied people who've gone for mental health treatment at temples, and have found some improvement. Certainly, we know that there's a powerful suggestive effect that the mind can have on the body. I would say the suggestive effect of the mind on the mind is even more powerful. And
than the effect on body.
Exactly. If the idea of belief and your confidence are enhanced, I think that changes your neurochemistry. As do pills, but at least if you do it through a religious interaction or perhaps counseling, I think you know how to do it yourself. You learn how to do it.
Probably that is much more culturally, accepted. When you talk in terms of religious therapies and all.
Well, there's that too. Exactly, it's easily culturally accepted. There's, I think people are very reluctant to accept.
No, but what about the satisfaction factor among these 3 groups?
Well, there's that. Yeah, actually, another main finding as I looked at the aesthetic, visceral effect. What did it feel like to undergo therapy? I got this idea from the patients themselves. And this is because patients, for example, at the Ayurvedic mental hospital, which I went to in Kottakkal, were telling me that they enjoyed the therapy they were getting. Like the Talapodichil and Pichu, they were like a spa therapy. They felt relaxed, and cool and calm. And I thought that's very interesting. At the people in the Ayurvedic, the allopathic.
Did they receive any aromatherapy too? Pleasant smell?
I don't think that they did aromatherapy at that center, but they did in some places dhumapana, the sort of medicinal cigar inhaled through the nose.
Inhaling.
Exactly, and Ayurveda also has its pharmacology.
Yeah.
In fact, the first effective antipsychotic in Western medicine comes from Ayurveda,
Okay.
from the plant Rauwolfia serpentina.
Yeah,
It
true.
was, there's a story of how this happened in the 1950s, and that may also be a factor. But the sort of pleasantness of undergoing Ayurvedic treatment was really very much appreciated by the patients. Some of those patients I interviewed had left allopathic treatment because of electroconvulsive therapy, which can be quite dangerous.
ECT shock treatment.
Shock treatment, yeah, or side effects of the medications they were taking they found to be rather unpleasant.
Okay.
So some of them left therapy and pursued Ayurveda because there were fewer side effects and they found the therapy more enjoyable to undergo. And so I think that's an issue of ineffectiveness, because if your patients are leaving because they don't like how the therapy feels,
Right.
the effectiveness actually becomes a mooted issue.
Well,
And I think you need to. So in that study, I thought that we, in biomedical allopathic medicine, we could learn from this. That maybe to make mental healing environments sort of more aesthetically engaging. Places for people to help facilitate recovery.
Right.
I think it's really important that people should be able to learn from different systems and cultural differences.
So you mean to say
how
there is a need
improve.
to have an integration of these very systems? Probably give a better result?
Exactly. I think we should look at what each system does well
Okay.
and adapt it to other systems. And we should look at cultural, social differences to find out what's going well in some place and what's going badly in another place, and hopefully adjust and learn from these experiences.
Okay. So with all this thought, let me ask you a question in a nutshell. Based on all these various kinds of thoughts that whatever we have had right now,
Okay.
what do you think, is it that India has to look for mental health, better quality of care from US, or the other way around?
Well, I think if we're going to be objective and look at epidemiological studies, the U.S. should be looking to India for ideas about how to improve, because India is doing better. I'm just being scientific about this. I mean, that's a strange thing to hear for somebody who maybe works in international mental health, because you assume a developing country must always have a problem that you have to solve. Of course, that's not to say that there aren't problems here.
Yeah, that's right.
Of course, there's problems here. There's definite need for improvement in mental health in any place.
That's right.
But we shouldn't assume that the U.S. has the answer. I mean,
So you don't think that US has the best practice systems?
currently the system is not working very well in the U.S. right now. And India has a long history of trying to understand the psyche and the self, going back to the Vedas.
That's right.
That's one of my original intrigues with India as a college undergraduate student. I remember reading the Upanishads and thinking, this reminds me of modern psychology. That in India, people have tried to understand the nature of the self.
That's right.
And our relationship to our emotional lives for this long. I mean, and philosophers, Shankara, Vivekananda, Aurobindo, all of these people have worked on, in the US, understanding the self has never been such a major focus.
Okay.
I mean, in the West, you have Freud, you had William James, and you had
That's right.
psychologists who
Yeah,
worked on
that's
this,
right.
but India has a long tradition of studying. And I think that looking to some of these local understandings of psychology and the self is a resource that should not be overlooked in India and should not be lost.
Okay.
And I know many people are looking at that here. I know people at the University of Kerala and other places who take very seriously India's own indigenous psychology traditions as well.
Yes. So, Mafi, we had lots of topic covered in our discussions,
yes,
and
yes.
On behalf of MindWatch, I'm extremely grateful to you, and let me thank you for your, your views and suggestions and your academic exercises, whatever you have done right now. Thanks a lot.
Okay, all right. Well, thank you for having me. I appreciate the opportunity to speak to you and to people in Kerala about these issues.
Okay. Thank you.
Okay.